Bonjour à tous. Welcome and thank you for participating in today's media update on COVID-19 in Canada with Canada's Chief Public Health Officer, Dr. Theresa Tam, and Deputy Chief Public Health Officer, Dr. Howard Njoo. Bonjour et bienvenue à la mise à jour médiatique sur la COVID-19 au Canada avec l'administratrice en chef de la santé publique, Dr. Theresa Tam, et le sous-administrateur en chef de la santé publique, Dr. Howard Njoo. Following the remarks, we will open the teleconference line to questions from the media. Suite aux allocutions, nous répondrons aux questions des médias. Procédons maintenant à la séance médiatique. Let's begin today's briefing. Over to you, Dr. Tam.
Merci beaucoup. So bonjour à toutes et à tous. This week is National Volunteer Week in Canada, and we're reminded, especially during these difficult times, of how important it is to support each other, to lend a hand when you can, and to know you're not alone when you need help. To date, over 1,139,000 cases of COVID-19, including over 23,700 deaths, have been reported in Canada. Over the past week, an average of over 8,640 new cases were reported daily. During the same time, the number of people experiencing severe and critical illness continued to rise. On average, over 3,970 people with COVID-19 were being treated in our hospitals each day, including 1,200 people being treated in intensive care units, representing a 24% and a 21% increase, respectively, compared to the prior week. An average of 46 deaths were reported daily over the past week, which is 28% higher than the week prior. There are over 70,300 variant of concern cases reported to date across Canada, with the B117 variant accounting for almost 96% of these. To tackle this wave, we need to use all available tools. That means keeping up with individual precautions and public health measures in your area, as well as deploying all safe and effective vaccines in optimal ways. Vaccination is fundamental to ending the pandemic, and we encourage all Canadians to get vaccinated to protect themselves and their communities from illness, hospitalizations, and deaths from COVID-19. This week, we marked the important milestone of over 10 million doses of COVID-19 vaccine having been administered in Canada. We know there is still a way to go, but we continue to gather strength from good news and are focused on the things we're grateful for. The simple note of thanks we recently received from a Canadian reminds us of how far we have come. I received a vaccine this week, and I am amazed that this time last year we were struggling to understand this virus, and now we are vaccinating against it. Canadians across the country have been channeling this kind of positive energy to help others. One example is vaccinehunters.ca. This community group has banded together to supplement COVID-19 vaccination initiatives by aggregating up-to-date information on vaccine availability on their website and social media platforms. They are helping eligible Canadians find vaccination clinics and pharmacies where they can book an appointment. Their website also provides links to other local volunteer organizations, such as Pink Cars, who are helping seniors 70 years or older in the York region with transportation to get to their COVID-19 vaccine appointments. Similarly, Vaxstat.ca helps Quebecers find the same day or next day COVID-19 vaccine appointments through their website. Another important volunteer effort is dispelling misinformation to support informed and confident decisions on vaccination. Teams of independent scientists, health professionals, and science communicators have come together in collectives such as Science Up First and the Canadian Muslim COVID-19 Task Force to make science more accessible across platforms, cultures, and languages. Though this may not be your turn yet, there are many ways younger adults can pay it forward and help family, friends, and neighbors get vaccinated by working online, over the phone, or in other ways to help others. Working together, we can bring the infection rate down and keep it down until vaccines have rolled out across the Canadian population. This is how we can all build the vaccine bridge that takes us to greater safety and back to the things we have missed so much. Thank you.
Merci. Bonjour à toutes et à tous. Cette semaine est la semaine de l'action bénévole au Canada. Elle nous rappelle, surtout en ces temps difficiles, combien il est important de s'entraider, de donner un coup de main quand nous le pouvons et de savoir que nous ne sommes pas seuls quand nous avons besoin d'aide. À ce jour, plus de 1 139 000 cas de COVID-19, dont plus de 23 700 décès ont été recensés au Canada. Au cours de la dernière semaine, plus de 8 640 nouveaux cas en moyenne ont été signalés chaque jour. Au cours de la même période, le nombre de cas graves et critiques de la maladie a continué d'augmenter. En moyenne, plus de 3 970 personnes atteintes de la COVID-19 ont été traitées dans nos hôpitaux chaque jour, dont 1 200 personnes étaient traitées dans des unités de soins intensifs, ce qui correspond à des augmentations de 24 et de 21 respectivement par rapport à la semaine précédente. En moyenne, 46 décès ont été recensés chaque jour au cours de la dernière semaine, soit 28 de plus que la semaine précédente. Nous enregistrons plus de 70 300 cas de variants préoccupants à ce jour au Canada, le variant B117 représentant presque 96 des cas. Pour lutter contre cette vague, nous devons utiliser tous les outils à notre disposition. Cela signifie d'appliquer les précautions individuelles et les mesures de santé publique dans sa région, ainsi que d'administrer de manière optimale tous les vaccins sûrs et efficaces. La vaccination est fondamentale pour arrêter la pandémie et nous encourageons tous les Canadiens à se faire vacciner pour se protéger et protéger leur communauté contre la maladie. Les hospitalisations et les décès dus à la COVID-19. Cette semaine, nous avons franchi une étape importante. Plus de 10 millions de doses de vaccins contre la COVID-19 ont été administrées au Canada. Nous savons que la bataille n'est pas gagnée, mais nous continuons à nous réjouir des bonnes nouvelles et à nous concentrer sur les choses pour lesquelles nous sommes reconnaissants. Ce simple mot de remerciement que nous avons reçu récemment d'un Canadien nous rappelle tout ce que nous avons accompli. J'ai reçu le vaccin cette semaine et je ne peux pas croire qu'à la même époque l'an dernier, nous avions du mal à comprendre ce virus et qu'aujourd'hui, nous vaccinons les gens. Partout au pays, les Canadiens ont fait rayonner ce genre d'énergie positive pour aider les autres. VaccineHunters.ca en est un exemple. Ce groupe communautaire s'est formé pour compléter les initiatives de vaccination contre la COVID-19 en rassemblant de l'information actualisée sur la disponibilité des vaccins sur leur site Web et les plateformes des médias sociaux. Ils aident les Canadiens admissibles à trouver des cliniques de vaccination et des pharmacies où ils peuvent prendre rendez-vous. Leur site Web fournit également des liens vers d'autres organisations bénévoles locales, telles que Pink Cars, qui aident les personnes âgées de 70 ans ou plus de la région de York à se déplacer pour se rendre à leur rendez-vous de vaccination contre la COVID-19. De même, le site web vacstat.ca aide les Québécois à obtenir un rendez-vous le même jour ou le lendemain pour se faire vacciner contre la COVID-19. Un autre effort bénévole important consiste à dissiper la mésinformation pour que les gens puissent prendre des décisions éclairées en toute confiance en matière de vaccination. Des équipes de scientifiques indépendants, de professionnels de la santé et des communicateurs scientifiques se sont regroupés pour former des collectifs tels que la Science d'abord et le groupe de travail canado-musulman contre la COVID-19, afin de rendre la science plus accessible, quelles que soient les plateformes, les cultures et des langues. Votre tour n'est peut-être pas encore arrivé, mais sachez que les jeunes adultes peuvent de diverses façons poser une geste concrète et aider leur famille, leurs amis et leurs voisins à se faire vacciner en travaillant en ligne, par téléphone ou par d'autres moyens pour aider les autres. En travaillant ensemble, nous pouvons abaisser le taux d'infection et le maintenir bas jusqu'à ce que la campagne de vaccination ait été menée dans toute la population canadienne. C'est ainsi que nous pourrons tous contribuer à atteindre l'immunité que nous permettra d'être en sécurité et de profiter à nouveau des choses qui nous auront en temps manqué. Merci.
Thank you, doctors. We will now open the phone line to questions. Please identify yourself and include the media outlet that you are representing. We'll be taking your questions in both official languages, and we ask that you limit yourself to one question and only one follow-up. Comme d'habitude, veuillez vous nommer et nous dire quel média vous représentez. Nous vous demandons de vous limiter à une question et seulement une question de suivi, et vous pouvez poser vos questions dans l'une des deux langues officielles. Donc, commençons la période de questions. Over to you, Mathieu.
Merci, thank you. Please press star 1 at this time to ask a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. The first question, la première question est de Philippe Vincent Foisy de Radio-Canada. La parole est à vous.
Oui, bonjour. J'ai une question en français sur les recommandations de NACI, donc du Comité consultatif canadien sur l'immunisation. Hier, on était censé avoir une conférence de presse sur AstraZeneca. Elle a été annulée. Pourquoi elle a été annulée? Pensez-vous pas que ça ajoute un peu des craintes par rapport à la confiance que les gens ont envers ce vaccin-là? Donc, juste essayer de nous expliquer ce qui s'est passé, pourquoi on a décidé de retarder les recommandations, puis qu'est-ce que vous pensez du fait qu'on les donne aux 40 ans, aux 45 ans et plus?
Oui, merci pour la question. C'est Dr. Njoo. Oui, c'est toujours quelque chose qui est, comment dire, un enjeu actuel. Qu'est-ce qui se passait? Je comprends que c'est le Comité consultatif national de l'immunisation, le CCNI en français, est en train de recevoir et aussi analyser d'autres comme des données probantes qui se sont soumises à jour. C'est toujours un défi parce que si on attend toujours des autres données probantes avec l'expérience à travers le monde, mais aussi au Canada, on peut être critiqué pour être trop tard, mais si on déclare peut-être trop vite et peut-être le lendemain, il arrive encore d'autres données probantes, on est aussi critiqué de l'autre façon. Donc, ce que je comprends, ils sont en train d'analyser des données probantes importantes, je pense même ici, qui arrivent au Canada, qu'est-ce qui est disponible ici au Canada. Je pense concernant aussi les bénéfices et avantages, ça va peut-être ça va donner des autres considérations peut-être pour ajuster leurs recommandations. Mais je pense, en fin de compte, je pense que ce que le comité est toujours sensibilisé à faire, c'est de donner des recommandations avec leur expertise pour les provinces et territoires à considérer pour leur propre programme de vaccination. Parce que c'est en fin de compte, c'est vraiment les provinces et territoires qui sont responsables. Et je pense que les changements maintenant même, les quelques provinces ont déjà fait des modifications, des changements. C'est aussi parce que on a eu une réunion, même une téléconférence la fin de semaine précédente avec le comité et on a discuté aussi les dernières données probantes disponibles. Donc, les provinces et territoires ont déjà commencé à adapter leur programme de vaccination et maintenant, le comité est en train d'analyser d'autres données probantes et je pense que bientôt, ils vont faire une autre déclaration, peut-être avec une mise à jour de leurs recommandations. Et je pense que la question pour confiance, j'espère que ça va donner aussi un niveau de confiance pour toute la population canadienne parce que ça indique que le comité prend au sérieux le travail et est toujours en train d'analyser, de recevoir les données probantes pour ajuster avec la science qui continue à évoluer. Merci.
Merci, Dr.
Theresa Tam, could I...
Can you just repeat that in English, please? Yes, go ahead, Dr. Tam.
Yes, I was going to just repeat that in English because I think everybody seems to have an interest on this question, which is about the National Advisory Committee on Immunization and why they didn't do the technical briefing yesterday. So as Dr. Njoo had indicated, the committee, the National Advisory Committee on Immunization, was about to release their latest recommendations, an update to the recommendations for the use of AstraZeneca vaccine in light of the rare report of a serious blood clotting and low platelets disorder. And just to reassure everyone that it is because they received some new data that they thought was pertinent in terms of analyzing the impact of the COVID-19 on the population in light of variants of concern, and not because of any changes in the data already existing for the thrombosis disorder itself. That remains a rare disorder, and the rates that they were looking at hasn't changed. It's more when you're balancing the benefit and risk analysis, it's important to look at the benefit of the vaccinating individuals, given the increase in the epidemic activity in many parts of the country. And so that is what they're working on, just to validate the information that they had before with the new data. But as Dr. Njoo said, the data is always undergoing evolution. So they're going to take this final look, and then they'll be out with the update shortly. We did have a meeting with all the chief medical officers and the National Advisory Committee on Immunization over the weekend. So they do have the analysis at hand as they were making their decisions that you have seen announced over the last few days.
Thank you, Dr. PV. Question suivie?
Oui, on voit qu'il y a des vols en provenance du Brésil encore qui sont acceptés au Canada. On voit qu'il y a des vols en provenance d'Inde aussi qui viennent du Canada. À quel point la santé publique se préoccupe de voir qu'il y a des gens qui peuvent encore rentrer au pays avec des variants venant de pays où la situation n'est pas du tout sous contrôle? À quel point ça, c'est préoccupant? Surtout quand on se souvient du rapport du vérificateur général qui disait qu'il y a une grande partie où le suivi n'est pas fait. Donc, est-ce que la santé publique est inquiète de voir qu'il y a encore des vols en provenance de pays où les variants très dangereux sont prédominants?
C'est Dr. Njoo, peut-être moi je peux commencer. Oui, c'est toujours quelque chose qui, c'est une préoccupation. On surveille toujours qu'est-ce qui se passe à travers le monde et aussi qu'est-ce qu'on fait avec nos frontières parce que la sécurité, pour protéger la santé des Canadiens, c'est toujours une priorité. Donc, je pense que avec les mesures qui sont déjà en vigueur à nos frontières, maintenant, on exige tous les voyageurs qui arrivent au Canada d'avoir même un test de dépistage avant leur arrivée ici au Canada, puis un autre test de dépistage avec l'arrivée, et puis un autre 10 jours après pour assurer qu'ils ne sont pas contaminés avec l'infection. C'est sûr, c'est aussi avec une quarantaine obligatoire de 14 jours. Donc, avec ça, je pense qu'au complet, je pense que c'est vraiment des mesures parmi les plus exigeantes partout dans le monde. Mais à part de ça, oui, on sait, et toujours qu'est-ce qui se passe avec l'émergence des variants partout dans le monde. Et vous avez constaté, peut-être c'est le Brésil maintenant, et peut-être l'Inde, mais peut-être un autre pays plus tard. Donc, je pense que c'est toujours important d'avoir aussi, comme on dit, une approche globale, pas toujours, comme on dit, viser sur les pays, après, comme on dit, identifier une variante, parce qu'en effet, c'est un peu trop tard. Hein. C'est comme chasser la queue. Je ne sais pas en français ça traduit bien, mais je pense qu'on est toujours aussi ouvert, toujours à examiner qu'est-ce qu'on fait à nos frontières et on peut toujours ajuster avec les données probantes et avec l'analyse et l'expérience des autres pays. Mais par contre, je pense que c'est important de constater aussi, c'est pas seulement une question des variants à nos frontières, qu'est-ce qui se passe dans les autres pays, parce qu'on sait avec les virus, c'est presque impossible, empêcher l'entrée des variants ici au Canada. Regarde qu'est-ce qui se passait avec le variant identifié au Royaume-Uni. Je pense que c'est très important aussi qu'est-ce qu'on fait au sein du pays après avec l'émergence des variants. C'est très important de faire le suivi des contacts, toutes les bonnes mesures de santé publique. Il faut souligner beaucoup de choses. Il faut faire ici aussi, comme il dit, dans le pays, à part de seulement regarder et viser sur qu'est-ce qu'on fait avec nos frontières. Merci.
Merci, Dr. Njoo. We'll take the next question.
So maybe, sorry, it's Theresa Tam. I'll just repeat that in English because I think there'll be another question, there'll be a similar question coming up about the border measures and what we're detecting and what might be some of the concerns. So, of course, the virus globally is undergoing evolution, and there are many different mutations and changes in the virus, particularly in countries that have a lot of cases. Of course, that gives the virus more chance to do that mutation. There's been several that's been identified as variants of concerns that you've all heard about, the B117, B1351, and the P1, which was originating from Brazil. So given that situation, the strategy for Canada was to add more layers of protection for every country. So the pre-boarding test, the post-arrival 2 tests, and of course our foundation, which is the 14-day quarantine, trying to add more reinforcements, the government authorized accommodation to await that first test, and just engaging more people on the ground, ensure compliance, were all put together at the time when the UK first notified of a variant of concern. There are many variants which are under monitoring, which we call variants of interest, which includes the variant that has been reported from India. We don't understand enough about it, but there are mutations on it that are similar to other variants of concern, which means that, of course, we need to look at that data very carefully, but there's not a lot of information that's coming out of India at the moment. But so these are universal measures that we've been layering upon at the border. The testing has been very helpful. So we've been detecting test positive travelers, as well as sequencing every one of them to look at what variants might be coming across the border, and that will help inform us of what further needs to be done. For Brazil, there are low numbers of travelers. The P1 variant has been picked up through border screening, but not just from Brazil though, because we know that it's actually in 50 probably now, somewhere between 40 and 50 other countries. So country-specific targeted measures can only go so far. It's actually the broader application of measures to all countries that Canada has been focused on. India, we will be doing further analysis because it's an emerging situation, not just because of the variant of interest at this point, but because they have unfortunately, a very massive resurgence in that country, and we'll be doing that risk assessment again and using the data that we have now collected at the border to inform our next steps. Thank you.
Thank you, doctors. Now we'll go to the next question, opérateur.
Merci. The next question is from Annie Bergeron-Oliver of CTV National News. Please go ahead.
Hi, thank you for taking my question. Nearly 1 million people in Canada now have nearly 1 million Canadians have now been fully vaccinated, and many of those are high-risk seniors living in congregate care. The CDC eased public health restrictions for fully vaccinated people weeks ago. Why hasn't Canada changed the rules, especially when it comes to seniors who are essentially still locked up in their long-term care homes?
So yes, we've had 10 million close to 10,500,000 individuals vaccinated, at least with the first dose. And we do know that some of the long-term care facility residents are now receiving their second dose. So that's great news. The other great news, of course, is seeing in the seniors coming down and the number of long-term care facility outbreaks coming down. And even the ones having outbreaks, there are fewer cases. So that vaccine effectiveness is being monitored in key jurisdictions with researchers and demonstrating the effectiveness of that initial dose, but coming back with that second dose. So I think that's important. And to change policy, I do think that the long-term care facilities are the one area where you will see that policy shift beginning, so that there will be more ability for seniors in those homes to return back to some of the normalities and having more visitors, although the visitors, of course, may not be vaccinated at this point in time. But all of the precautions still has to be taken. But provinces are in charge of those policies, and you will begin to see them using the data at hand and what they're seeing on the ground in order to adjust those policies. But of course, outside the doors of the long-term care facilities, we have a ways to go. Some of the senior age groups haven't completed the vaccination, although those seem to be going well. And healthcare workers, we want to make sure they're all provided with a vaccine. I think the uptake's really good too in healthcare workers, close to 90% with at least one dose. But just a reminder that, of course, Canada's strategy is getting one dose to everyone as fast as possible on all the eligible age groups and coming back with that second dose. We are taking a community-based approach where individuals are protecting themselves with that very effective first dose, but also to generate the community level of I protect you, you protect me kind of concept in direct protection, so that everyone can benefit from increased social and connections as a result of that community-based, population health-based approach. But I do think that, of course, we'll all begin to adjust those measures. But if you look at the United Kingdom being the country closest to us with their strategy of the one dose with stretch interval, they are being very careful. You need to drive down that epidemic. So this third wave needs to come under control, and then we need to be able to ease those measures very slowly while the vaccine coverage is increasing.
Okay, well, that leads into my next question. My follow-up is that a chart in the budget suggests about 80% of Canadians will have at least one dose by Canada Day, with the economy projected to pick up drastically starting very shortly after. Will a strong majority of Canadians only getting one shot be enough to ease restrictions across the country?
So what eases restrictions across the country is getting the epidemic under control, the pandemic in Canada under control. That has always been the driver of easing measures. Do not ease measures rapidly on the way down. Like, this is what happened in that second wave. You ease, partially down the epidemic curve, the virus will come back very quickly. With vaccines on board, the chances of that may be diminished, but it's not, completely eliminated. And so getting that second dose is very important to ensure that when we relax measures, you're not back to sort of the beginning of trying to get the virus under control. It has to be both public health measures and the vaccine right now to plank the curve again. That's what's going to let us have more relaxation in those restrictive public health measures. So, of course, we want to track this as we go along, but vaccines gives us a much better chance of being able to do that. So that's why it's very important to get vaccinated.
Yeah, it's Dr. You just said to underline what Dr. Tam said. I think we've said it several times, myself included, that we should be following the data and not just dates. So vaccination, certainly vaccines are a very important tool, very key in terms of, as you say, trying to get towards a sort of a future where we might be relaxing some restrictions, but certainly the public health measures are key. Certainly, look what's happening now in Ontario. It's not going to be vaccines alone that solve the current situation in Ontario. You need to be very strict with the public health measures. And I would say that's also twofold. I think at an individual level, people really have to think about what activities they're undertaking. Are they really just the essential activities, going out for groceries and so on? Or, are there still some discretionary activities that they really should not be doing, like, traveling for a vacation or going for a recreational sort of a pleasure activities, even outside of their own community. So that's something to consider. And then, of course, at the population level with governments and so on, it's a type of restrictions that really try to decrease mobility and decrease the types of interactions, the number of interactions people have. And I think to support, what was put forward by the Science Advisory Table in Ontario, it's not just a matter of saying people, decrease your contacts. There are many people, the essential workers, that are not able to, for lots of reasons we all know about, in terms of lack of sick days, other social supports, and so on. So I think to get to that point, it's very important to have those supports as well, so that all Canadians can hopefully, in a sense, feel protected and have the measures in place that they can also practice personally, and also at a population level of the public health measures as we keep rolling out the vaccines. Thank you.
Thank you, doctors. We will move to the next question. Prochaine question, opérateur.
Merci. La prochaine question est de Raymond Filion de TVA. La parole est à vous.
Merci beaucoup. Dr. Njoo, juste pour revenir à l'un des ces variants, est-ce que suspendre les vols, comme ça a été le cas cet hiver pour le Royaume-Uni, pourquoi ce n'est pas un scénario qui est envisagé à l'heure actuelle? Si vous pouvez juste expliquer ça brièvement.
OK, brièvement, je pense que, je pense même le premier ministre a constaté, en examen, il y a toujours, comme dit, toutes les options sur la table. Donc, je pense qu'il faut faire une analyse, parce qu'on a maintenant aussi, comme dit, l'expérience avec qu'est-ce qui se passait avec, comme vous avez constaté, l'expérience avec le Royaume-Uni. Après ça, on a mis des autres mesures en vigueur à nos frontières, avec les dépistages avant l'arrivée des voyageurs ici au Canada, puis aussi les 2 dépistages, aussi la quarantaine de 14 jours obligatoire. Donc, il faut examiner les mesures qui sont déjà en place maintenant. C'est quoi l'efficacité des mesures? Est-ce qu'on peut faire des autres ajustements? Comme Dr. Tam et moi, on a constaté, c'est difficile toujours comment dire, de viser un pays à la fois. Je pense que c'est peut-être plus important, plus efficace, peut-être avoir une approche, comme dit, globale pour assurer la sécurité à nos frontières, comme si c'est possible. Mais oui, aussi, au fur et à mesure, s'il y a quelque chose qu'on peut faire, comme dire, rapidement pour gérer une situation, par exemple, pour l'Inde, je pense qu'on est toujours ouvert, et on est en train d'avoir les discussions et aussi une évaluation, une analyse des risques à l'heure actuelle.
En suivi, à quel point, selon vous, c'est impératif à l'heure actuelle de réduire ou d'éviter complètement les déplacements entre une région à l'autre du Canada, entre les provinces, surtout avec les variants?
Oui, je pense que c'est un enjeu actuel. Je pense avec toutes les provinces et territoires, je pense même en Colombie-Britannique, on a déjà conseillé, encouragé, je ne sais pas c'est quoi, tout le vocabulaire, les mots des Canadiens, de ne pas se déplacer, vraiment rester chez vous, rester dans votre région. Peut-être, oui, c'est toujours important de peut-être sortir, prendre l'air fraîche, mais seulement dans votre communauté, pas vraiment se déplacer, même dans votre région. Je pense que, par exemple, en Colombie-Britannique, si on est à Vancouver, on décourage les gens de même aller à Whistler, même si c'est dans la même région, on peut dire, de la Colombie-Britannique. Je pense que c'est le même principe partout dans les pays et aussi on décourage les gens de se déplacer entre les provinces. Je pense que c'était un enjeu avant que même on a vu beaucoup de Canadiens sont allés peut-être dans les autres provinces pour les loisirs, des vacances de ski et maintenant c'est hey, avec les variants, c'est vraiment important. On voit qu'est-ce qui se passe actuellement en Ontario, c'est une crise de santé publique, une crise avec le système de soins de santé. Je pense qu'il faut vraiment, comment dire, tirer des leçons avec qu'est-ce qui se passe actuellement en Ontario et c'est vraiment pour tout le monde, restez chez vous. C'est simple.
Merci, Dr. Njoo. Our next question.
Thank you, merci. The next question is from Evan Dyer of CBC News. Your line is open. Please go ahead.
Hello, thanks for taking my question. I'd like to ask, you mentioned that you're currently doing a risk analysis on the situation in India. Do you know when that might be ready?
I can't comment on that. We are always looking at the data, including who is testing positive coming into Canada, for example, and we have to get as much information as possible, for example, on that variant of interest, and which is not yet a variant of concern. So lots of work is being done in multiple departments to look at that situation. But as I said, that it can be one country one day, another day. So it is very important that we have been taking these more broad measures for any traveler.
And just to follow up on that, I know that India and Brazil both have variants, but are very different countries in a way. I mean, India's been a kind of a model citizen, sharing vaccines with other countries. Brazil, I think, has been widely seen as a very irresponsible government, not taking COVID seriously. You were talking about the idea of, I protect you, you protect me, and we do penalize individuals who don't take COVID seriously in Canada. Do you think that as this pandemic develops and as we start to emerge from it, there will be a place for pressure or action against countries that don't appear to be taking COVID seriously, continue to spin off variants that threaten other countries' vaccination campaigns?
Well, I think, internationally, in many ways, we are in it together. And as long as countries are not able to control what's happening domestically, it will affect everyone else. But we have to control what we can control, which is the measures that we've sort of put in place. The many layers, we kind of kept adding some more. But the testing regime, I think, is really important so that we can manage the individuals coming into Canada and reduce the risk of the variants of concern. I mean, I think if you look back at the statistics, the number of travelers have already been significantly reduced compared to, of course, pre-pandemic times. But these layers of measures are meant to help us reduce that spread. No border measures are completely 100% effective, of course. Every layer adds another layer of protection. I do think that it is important, wherever we can, to assist others so that it has a benefit at the other end for Canadians and people who are in this country as well. So I think it takes so many layers of discourse and arrangements, some of which is not really in the agency's area of influence. But I think the whole of government and our ministers are, of course, looking at that in terms of other countries. Anyways, I think maybe I'll leave it at that. Thank you. But Brazil and India are actually very different on many other fronts. There are many more connections with India to Canada than there is to Brazil for all sorts of reasons, and many different types of travelers and many Canadians who are in India, and there's traffic from that perspective as well. So there's many considerations before any other actions taken.
Thank you. Operator, next question. Prochaine question.
Merci. La prochaine question est de Boris Proulx du Devoir. Votre ligne est ouverte. À vous la parole.
Bonjour, j'aimerais rebondir sur la question plutôt concernant le Comité national sur l'immunisation. J'aimerais savoir si vous pouvez me résumer quels sont ces travaux en ce moment parce que on veut savoir ce qui se passe. On comprend que 10 minutes avant la conférence de presse hier, ils l'ont annulé parce qu'ils ont reçu de nouvelles informations, c'est ce que vous dites, juste au moment où les provinces abaissent l'âge du AstraZeneca à 40 ans. Donc, pouvez-vous me dire exactement qu'est-ce qu'on étudie de ce côté?
C'est Dr. Njoo, peut-être moi je peux commencer. Oui, si je peux peut-être préciser qu'est-ce qui se passait pendant la semaine, on a eu une téléconférence avec le Comité consultatif national de l'immunisation, le CCNI, avec aussi le Comité consultatif spécial, tous les médecins hygiénistes des provinces et territoires. Et je pense que c'est basé sur la discussion, les données probantes, la présentation de CCNI, je pense à la fin de semaine précédente, que les provinces et territoires ont annoncé les modifications, les ajustements dans leur propre programme de vaccination pendant la semaine. Et maintenant, le CCNI est en train de recevoir d'autres données probantes. Je pense que ça ne va pas changer. Ce que je comprends, c'est vraiment sûrement pour être plus à jour avec, je pense peut-être les avantages, regarder vraiment à l'échelle de la population, avec en considération aussi avec l'épidémiologie régionale, tout ça. Il y a beaucoup des facteurs, mais je pense, en fin de compte, bientôt, on attend impatiemment la présentation, déclaration, peut-être un peu ajustée avec, en considérant les nouvelles données probantes. Mais je pense que pour les provinces et territoires, ce n'est pas vraiment un grand changement parce qu'ils ont déjà reçu, comme on dit, les données probantes importantes de CCNI et ils sont en train déjà d'ajuster. Je pense, en fin de compte, pour AstraZeneca, je pense que tout le monde est d'accord, c'est un vaccin efficace et sûr. En effet, c'est un vaccin homologué par Santé Canada et c'est très important maintenant avec la troisième vague dans plusieurs provinces d'utiliser tous nos outils le plus tôt possible, de vacciner le plus grand nombre de Canadiens le plus rapidement possible. Donc, je pense que le fait que les provinces, comme vous savez, ont déjà, comme on dit, ajusté, comme on dit, avec le groupement d'âge pour être éligible pour le vaccin AstraZeneca, démontre que c'est vraiment quelque chose d'important et on va continuer à suivre la science et peut-être ajuster au fur et à mesure comme c'est nécessaire.
Justement, je crois qu'en début de semaine, vous aviez répondu à une question concernant les femmes qui étaient peut-être plus touchées par les problèmes rares de caillots sanguins. J'aimerais savoir si, au fur et à mesure du cumul des données probantes, il est possible ou vous considérez prioriser certains types de vaccins en fonction du sexe. Donc, certains types de vaccins pour les hommes, par exemple, certains types pour les femmes.
OK, c'est Dr. Njoo. Moi, peut-être je peux répondre pour préciser. C'est un événement très rare. Et c'est sûr, c'est comme même, comme on dit, la physiologie, comment ça arrive avec cet événement très rare avec comme on dit, les caillots sanguins. C'est différent peut-être si on a déjà comparé avec des autres risques peut-être pour les femmes avec la contraception. Je pense qu'on n'a pas assez de données pour vraiment tirer les conclusions qu'il y a vraiment une différence. Les premiers cas qui ont été signalés, je pense en effet, c'est peut-être une biais parce que si on a commencé avec la vaccination des travailleurs, travailleuses des soins de santé au début parce que c'est un groupe prioritaire. On sait que parmi ce groupe de priorité, il y a beaucoup de femmes parce qu'ils sont des infirmières, tout ça. Donc, ça, c'est quelque chose aussi à souligner comme un point. Donc, jusqu'à date, avec toutes les analyses des données probantes, on n'a pas trouvé qu'il y a vraiment une différence. On peut dire que c'est vraiment les femmes sont plus à risque que les hommes. Donc, je pense que c'est pourquoi le Santé Canada ou aussi tous les autres régulateurs à travers le monde ont encore recommandé pour tous pour les femmes et aussi pour les hommes. C'est pas comme OK, c'est plus comme un risque augmenté pour les femmes.
Theresa Tam, I'll just clarify that point as well in English, that there is no specific risk factors for the thrombosis, thromboembolic syndrome with low platelets. It's a very specific underlying mechanism that is driving that rare event. There is no sex or age risk factors for that condition. How provinces in deciding the program and the National Advisory Committee on Immunization comes with a recommendation according to age groups is actually based on the impact of COVID on different age groups, where you get a much more severe outcomes in the older age groups. It's not because there's an underlying risk factor that is currently evident on the thrombotic event.
Merci beaucoup. Operator, next question. Prochaine question.
Thank you. The next question is from Mia Rapson of the Canadian Press. Your line is open. Please go ahead.
Yeah, I'm just wondering, Dr. Tam, if you could give us some more information about exactly what data was provided to NACI, what study. You said it wasn't about the blood clots, but more about the variants. I'm just wondering if you could tell Canadians what specifically they were given new data on that sort of pushed this back, not just a little bit, but by several days. And also, how relevant has NACI made itself in a pandemic when maybe the model isn't set up to make decisions as quickly as we need them? Do you think that this model is actually working in a pandemic?
Well, science is always evolving and is evolving fast. So it is quite challenging. And I can guarantee that everyone from the regulator to NACI to our epidemiologists are working continuously. So you're right in that you can't just keep shifting recommendations all the time. You do have to have analysis that you can settle on for now. Obviously, if there's any significant changes, the committee will go back and have another look. So I don't have all the details. All I was told is actually about the impact of COVID-19, including the emerging variants of concerns, impact on severe outcomes. So that data has to come from the provinces and territories. And as they provided some new information, particularly and on that front, I think that's what they're looking at. And it may not change anything in terms of what they've already come down to. I'm not sure. That is still in progress. And maybe I can leave it at that. But it is challenging for everyone in terms of the policy space for public health. But we want to, I think uppermost in everybody's minds right now is that we wanted to provide the best advice because it's about safety. And therefore, Canadians need to be reassured that all of these checks and balances are in place so that they can make those decisions to get themselves vaccinated.
Thank you. And Dr. Njoo, I understand that there was a meeting of the chief medical officers yesterday afternoon. The last time you met, or at least just discussed the AstraZeneca issue, it was decided that every province would follow the recommendation not to give it to people under 55. Now we have seen provinces sort of jump out and make different decisions. How hard is it for Canadians to understand what is happening or what they should do when the provinces aren't aligned, we don't have information from NACI, and how hard do you think this is going to be in terms of vaccine hesitancy?
Well, thank you very much. Multiple questions there. First of all, I would say that it's never a question of everyone quote being in lockstep. As NACI has indicated, and I think I've sort of said it as well, is that their recommendations that they put forward takes into account sort of a broader public health perspective compared to the regulator, which looks at a product on a one-by-one basis, looking at the overall sort of benefits versus the risk. So with respect to NACI, that broader public health perspective takes into account epidemiology, looking at other vaccines available, and so on and so forth. So taking that now a step further, as you mentioned, with the provinces and territories, at a certain point in time, based on their understanding, their knowledge of the epidemiology and their context, what they're doing with their vaccine programs, they more or less, I think, had a similar thinking and approach with respect to, I think you mentioned the pause for those individuals under age 55. Now what's happened is we've alluded to several times. There was another meeting teleconference that was held on the weekend. And as the province and territories looked at, sort of within their own jurisdictions, looked at their epidemiology, looked at the factors at play, they obviously, as always, the same principle, adjusted their programs to make sort of the best sort of a sense on their context. And therefore, you are seeing maybe a variation. Certainly, I think the 6 provinces Atlantic, to varying degrees. Their epidemiology, I think, in terms of case counts, serious illness, hospitalization, deaths, is different compared to, let's say, the territories up north in the Atlantic region as well. And therefore, that's why you're seeing, I think, adjustments made sort of to get out the vaccines in the best possible way based on the epidemiology. So I think, for example, Quebec, I understand they have a different age cutoff, but I certainly respect the fact that based on their epidemiology, based on their analysis of the factors, this is what makes sense for sort of the Quebec context. And then you can see in Ontario, they've made other adjustments where there's also, besides sort of the age, I think it's 40 plus, that's eligible for AstraZeneca. They're also looking at targeting, I think, maybe putting vaccines or having vaccines available for administration in so-called hot zones and so on. So you can see that the provinces and territories are doing what they believe based on the evidence and the science is really sort of best serving for their context. And I think Canadians hopefully can understand and get that it's hard to have a one-size-fits-all approach. The NACI puts out a broad recommendation, but I think it's more of I would call it a framework. It gives us certain parameters and certain factors to consider that obviously the provinces and territories then take to heart and then apply obviously their own lens and their own context before adjusting the programs as necessary and appropriate for their local situation. Thanks.
Well, thank you, Doctor. Operator, next question. Prochaine question.
Merci. The next question is from Tonda McCharles of the Toronto Star. Please go ahead.
Hi, thanks. I'll be honest, I don't really understand the explanation and the tie-in if NACI was getting information on the severe impact of COVID and variants, what that necessarily has to do with their expected recommendation as to the risk of thrombosis with the vaccines. And I understood that they were going to be weighing in on that. So maybe perhaps you can take another run at clarifying exactly why they couldn't give the recommendation clearly on the risk of the risk of the thrombotic events associated with the vaccines. And my question around that has to do with apparently there's been an analysis that all of the vaccines, both the mRNA vaccines and the viral vector vaccines, all carry this very rare risk. So I'm wondering if Health Canada is thinking of putting a warning similar to the one that you initially put out on AstraZeneca for all the vaccines.
So sorry, I might have missed the last bit. Just to really clarify, you brought up a very, very good point, which is the risk of the thrombotic event doesn't change. So that is not, it has not changed. It has not changed in the analysis. It is a rare event that occurs 1 in 250,000 to 1 in 100,000, I think is what broadly everyone has been using. Of course, the data could evolve, but that hasn't changed. What changes is what is happening with COVID-19 in your area that balances the risk and benefits, because the vaccine is going to be a very effective tool in reducing severe illness and deaths for sure. And so the benefits of the vaccine absolutely will outweigh the risk of the clotting disorder, particularly in areas of high transmission and high impact. So I'm not sure if that's clear enough, Tonda. Do you want me to?
That helps. Yes, thanks.
In your risk,
yep, thank you.
In your risk benefit analysis, yeah. So could you repeat your last part? Sorry about that.
Yeah. So given that there's some suggestion that all the vaccines, all 4, carry this rare risk, have we changed the warnings on all of them?
So I think that there's thrombotic phenomenon that may be different, that needs still be unpacked scientifically. But one other vaccine of interest to Canadians where changes is sort of expected is the Janssen vaccine. Janssen is a viral vector vaccine, very similar to that of AstraZeneca. So that also is a vaccine that Canada expects to be deploying. So Health Canada is aware of the EMA announced label updates that reflect reports of the blood clots with low platelets related to the J&J Janssen vaccine. So they're already reviewing that information and looking at that in our Canadian context. Similar process as they did with the AstraZeneca vaccine, and they'll be working with manufacturers, FDA, EMA, and other international regulators. So then they will take the action if necessary before that vaccine is made available to Canadians. That vaccine hasn't rolled out as yet. And the regulators at this time around the world have determined that for that vaccine overall, the benefits outweigh the risks. NACI will make recommendations on the Janssen vaccine, and it will take that information into account because that statement hasn't been drafted or finalized yet. So that's good because now they can take into account any new information on the blood clots or low platelets associated with that vaccine. And of course, we will be reviewing any information pertaining to any vaccines, but the Janssen vaccine is of the most interest at this point.
Thanks. And can I just ask quickly? There's a number of doctors who feel that either Canada has already approved I think at least one monoclonal antibody treatment, and yet there are others that are on the regulatory pipeline. And there are a number who feel that would be really effective right now, especially in places where the hospital systems are really under pressure, and it could take some of the people who are ending up in hospital out of the hospital scene and free up a little bit of capacity. Can you talk to us about that? What is your sense of whether these monoclonal antibody treatments either are available to them and not being used, and if they're not being used, why not?
Yes, I will try and answer that question, and maybe you can follow up with our media relations to get any more details because the treatment side is something that maybe you need to get more information from others and perhaps from the regulator. So we do know that there are these monoclonal antibody treatments available and other treatments as well. So you've provided a very important question, which is that, of course, we've been talking about vaccines, we've been talking about testing, diagnostics. Well, treatment is another area that there's been a lot of work in, and people are pursuing different kinds of treatments. But the most important one, actually, I really feel that changed a lot of the clinical practice is dexamethasone, the steroid that is commonly available to treat patients, was found to actually have a significant benefit, and it's become part of the routine management of patients in the ICU and in hospitals based on clinical judgment, basically. So what is available, I do know, is that tocilizumab is one medication and it helps like these antibodies to reduce inflammation, some of the significant inflammatory responses as well. And so medication has been purchased and made available to provinces and territories. And not all of them are using this medication to the same extent. And so, as I understand it, some of that supply has been shifted to Ontario from a reallocation from other provinces and territories. So that is an example of how that is happening right now.
Thank you, Dr. Tam. We have time for one last question. Dernière question, opérateur.
Merci, thank you. And our last question is from Crystal Ogue of Global News. Please go ahead.
Hi, Dr. Tam. Thank you for taking my question. We're specifically looking at Ontario here. The ICU numbers are raising and hospitals have transferred hundreds of patients. Is this something that comes up on your calls with provincial counterparts? And are these conversations about transferring as far away as other provincial ICUs?
It's a subject of intense conversation, I think, both at a political decision-maker level and at the operational level. So with the operations center at the Public Health Agency, as well as public safety and many federal departments, in terms of what offer of support we can provide to Ontario. That is on the healthcare side, so I'm less involved in that. But I know that we're looking at supplies from the NES for the National Emergency Strategic Stockpile. That helps ICU patients, whether they be ECMO machines, oxygen concentrators, oxygen supply equipment, and any of the other kinds of equipment they need. But having said that, mobile health units and other measures. What has been requested, I believe, also support for health workers. So it's not the equipment that is necessarily the rate limiting step. It's that you need teams of people experienced to operate these different types of equipment needed to support someone who's very sick. So I know that discussion is extremely live, and we do have underlying protocols and policies that support mutual aid between provinces and territories. And absolutely, that is a very live part of the discussion with Ontario right now.
Thank you. And as a follow-up, the European Union has turned down 300 million doses of AstraZeneca and Johnson & Johnson. What's your reaction to that decision, and does Canada intend to try and scoop up those doses for ourselves?
I missed the very beginning of your question. Who was giving up?
Oh, sorry. The European Union has turned down about 300 million doses of AstraZeneca and Johnson & Johnson. So my question to you is, what's your reaction to that decision, and does Canada intend to try and scoop up those doses?
So I haven't heard of that. Thank you for that piece of information. I'm not intimately linked to the supply, but all I do know is that every stop is being pulled. Ms. Annan would have spoken about this, and I know she's on the phone and other teams on the phone with European countries, any countries that may have supply. So I'm sure that that is very much part of their strategy, but I don't have any details. Thank you.
Thank you, Dr. Tam. That will conclude today's media update. C'est ce qui met fin à la conférence de presse pour aujourd'hui. Bonne journée.